storage space. Subject to you start storing all those movies, right? 2 साल के बाद buy another one. Or if you feel like, nahi, I want to go for the very best, go for 2 TB storage. That will cost you about 7,500. Bus. But when you go for the iPad upgrade, then straight away that would be a jump on of not less than 20,000-30,000, even more than that. Right? Saturday we talked about that. Saturday was off. Right? This was that after upper limb, what shall we do? After upper limb. This is for those who might not be present on who weren't present on that day when we discussed that after upper limb, I insist that you guys start lower limb by yourself, right? From the YouTube videos. And we'll be starting with the physiology. And there would be one day on the mutual consent that, okay, today, say next time we'll be learning lower limb. So on that day, straight away we'll revise, say, first 5 lectures or 4 lectures, right? So that way, right from the beginning till the end of 4th lecture, I'll be taking the things at a very high pace. But you'll be able to understand only if you have revised it properly. So this was in my mind when the question was asked by someone that we are doing anatomy, will we be doing other subjects also? Yes, this is what is in plan. And as touchwood, you guys stay with me even in the second year, right? So in that case, once again, we'll be doing it like that. Let's say we are learning pharmacology and pathology. Both the subjects, they are killer subjects. So in that case, I'll be putting some topics recorded on YouTube for, let's say, pharmacology. And then patho is something which I'll take live. And then once you have gone through these, let's say, 4 lectures, so then one day we'll revise everything. So where you can ask the questions directly and the clarity is there. And same thing over here, we can do it in the form of lower limb. And let's make it more interesting. The day we'll revise it, last half an hour would be a test. Correct? So how good it would be, learn and straight away appear for the test. So that's what it is in my mind, right? But I need your support. Achha, so that is after weekend or weekdays classes. Currently, so we are going for these 3 days a week. But I just got one email that is your lectures I have started for the college. Yeah, for the college. And what should be done? Well, in that case, your limb 2 lectures are done. Areva, very nice, Sai. Very nice. Good. So then follow, we need to follow this sequence, right? For all those who have joined recently, right? Many of you have joined late also. On YouTube, on my channel, the playlist is upper limb, right? Mastering anatomy, upper limb. And we are following exactly the same order. And today it is the 7th lecture which is in progress. So yes, if you have not done any of the previous ones, so then 1 to 6 is like a backlog. You need to see these things in series. As you ask the question, yes, it is necessary. You cannot really jump. Because ideally, say for example, today brachial plexus will be completing. We'll be revising brachial plexus, but we'll complete within 1.5 minutes. Now, if someone has not read that, they'll find it difficult. So yes, it has to be into that specific order. And when this question was there, regarding this study. Yes.
मम्मी येणार आहे संध्याकाळी
नाही उद्या येईल
हा ठीक आहे संध्याकाळी
Mute. Vishwa.
संध्याकाळी पप्पा बघतील
Good. So regarding the study plan, do we have to study more than 1 hour? 100,000%. 1 hour? यार मजाक समझ रखा है. You need to study. अभी से habit डालनी पड़ेगी. That's okay. I mean, you can say study in chunks, right? 45 minutes पढ़े, थोड़ा break लिया, again 45. But at least at this point of time also, at least I would say 4 hours. 4 hours तो कुछ भी नहीं है. This is medical, यार. आगे जाके तो कितना टाइम देना पड़ेगा. And think it like that how much you have to do in what time. So then suddenly you'll realize that boss, the load is so much that you need to spare time. And then you are expected to remember everything. ठीक है, तो टाइम तो देना पड़ेगा. 1 hour तो इट्स अ क्राइम. इट्स जस्ट टू लेस. मान ही नहीं सकते. 1 hour तो आप भूल ही जाओ. So if the lectures have started, right, we'll be going for weekend classes, but only when almost 70-80% of the strength is not available on the weekdays. Then and then we'll be going for the weekend classes. Abhi to weekend, matlab weekdays wala jo hai, that is Tuesday, Thursdays, and the Saturdays, 10 to till the topic is complete. Right? So that is the thing. Homework karo yaar. I feel bad. I don't speak much, but when I just get 15-20 email मिली तो then what's the point? अभी भी देखो ना, we are almost 110. कम से कम 60-70 email तो मिले. What was the homework actually? ठीक है. Now onwards, what I'll do is, happy Navratri, Yash. Now onwards, what I'll do is, on one page, I'll write the homework and I'll write it clearly. So even if you get the PDF, you'll know what is to be done. Okay? We'll do that. So in case if there is any network issue and you miss exactly that point, Bobby, I have seen one link related books with topic issue. Vishwa Consultancy have sent one link related books. Which topics we should choose in that link? Acha. Now, is that link, who has sent that message? While the link which has been sent to you, is it consisting of the list of books or the books are, I think you are given the e-books, right?
Yes,
That's
sir.
Yes, sir.
e-books. Okay. See, Guyton is for physiology. Okay? Guyton is for physiology. One of the best book, one of the finest book. Currently, we are doing anatomy. As this is the beginning of the medical, I won't be putting any pressure on you. Right? I'll be teaching you from Guyton only. But right now, I won't insist that you start reading the Guyton. No, you focus on something which we are discussing. Right? So by the end of this month, we'll be completing upper limb. Right? Just 3-4 more sessions. So at the most first week of next month, we'll be completing the upper limb. And then we'll have a grand test. Entire upper limb in a single shot test. And this time, it will not only be the MCQs, but this time it would be with Viva. Okay? Viva. Now in Viva, I'll be very clear. I won't be forcing you. If you say, yes, I'm ready, right? I want to appear for Viva, do send me the mail, right? I'll make a list and that list will keep on appearing on the side. So randomly I'm taking, let's say Tanish Patel. So if Tanish Patel, right, the order in which I'll be getting the emails, you'll be asked only 5 questions, right? 5 questions per career. Even if there are 100 students, those who are appearing for Viva, no problem. 500 questions would be asked, irrespective of whether that day belongs to 3 hours or 4 hours. I don't mind. But yes, I want to give you the taste of Viva, how interesting it becomes. But I won't be forcing you, right? Because the last time that experience was not very happy experience. They're telling again and again, boss, unmute yourself, and then still you are not unmuting. No, I'll not be tolerating that, right? It is like you send me the mail. Let's say Tanish tells, yes, I'm ready. Great. And the order in which I'll be getting, in that order, you will be heading for the Viva part. Okay? Once the Viva is complete, we can go for the theory part. In theory, there'll be specific questions, but this time, those MCQs, I'm thinking of that if in Viva, number of students are good, so almost everything would be covered. So then this MCQ will be more related to as if you are appearing for USMLE exam. That means instead of being MCQ, pure MCQ, it would be more or less clinically oriented, something which we have already discussed, right? Nothing will come out of thin air. So this is what it is in my mind. Do let me know that whether we should really go for this or you want to go for that normal standard test. ठीक है, मुझे बताना. Whatever you say is fine, but involvement is necessary. For those who are, say, very lovingly, you have written that I feel nervous in front of others. That's what I'm telling. यार ये तो तेरा home ground है. At the most क्या हो गया? People would laugh, right? It happens invariably. Say it used to happen with me. At least with me तो definitely. वो साला जिसको क्वेश्चन पूछा तो वो पता होता है रे तो मुझे आता है. But when the question comes to us, बस वही नहीं आता. Right? It happens. It would happen even over here. When you'll make mistake, people would laugh. Right? हंसने दो ना. That's the way. That's the way to progress. Okay? So I would insist that yes, do say yes for the Viva part. Can't force, but I would really insist. So many messages. Very fatafat. Maybe you have to study from BDC for the test. Well, dost, you study from these PDFs, right? Uske baad, once this is totally clear, you can definitely go to BDC, right? But I won't be asking you any crazy question which is coming out of thin air, which we are not even discussed, which we are not even talked about. No, I won't be. For the MCQ, that is when I'm telling about USMLE, it would be actually the clinical questions, right? Clinical questions which will be related to CT scan, MRI, angiography, but not before I really show all of those things to you. Right? So I'll be showing you that how the angiography is done. I'll show you the angiograms. I'll show you the CT scan, identifications, all the clinical things, right? And then the questions will be from those topics, not from the same images. Got it? Not the same images. Images would be different. But yes, you have to apply your mind. Okay. So what else? What are the other questions? Why is better as we learn from a absolutely. वही तो है. Yes, to Viva. Very nice. Chalo. At least my two students, they are ready for the Viva. By the way, just how many of you are ready for the Viva? देखते तो हैं. Just raise your hands. अपना नंबर तो देख कितना पहुंचता है.
So can you repeat the question?
Question is that are you ready for the Viva? If yes, raise your hand. I just want to get a feel. What number are we getting? This is one. If 3, 4, 5, 6, 7, 8, 4, 5, 6. At least you have 40 people who are ready for the Viva. मैं कथिक समर तनिष्क अदिति तनिष एक याद रखना. Right, I'm taking the screenshot of this. Seriously, let me take the screenshot. उस दिन अगर जो ना बोला ना तो मर गए. ये कम होने शुरू. Screenshot taken. Now you can do anything. अब तो जिन्होंने हाँ बोला है फंस गए. चलो, let's start with our today's topic. Okay, thank you. हाँ गजेंद्र. It is like Viva is optional. MCQ वाला जो है USMLE, that is compulsory for all. Good, good, good. So today we'll be talking about. So today you'll be talking about this arm. Okay, I'll write it. TILLURMBBS@gmail.com. Regarding how to study for the link of our common PDF folder, etc., just send a mail to me. I'll explain everything, because almost everyone is knowing. So we are not now spending time on this, and straight away we start with the topic. So this is the arm, right? We are talking about the arm. We have talked about the shoulder. We have talked about the bones, etc. So we are starting with easiest thing first, and that is the arm. Arm, which is having just one bone, and that is the humerus. That humerus, simply God has divided the compartment into two, anterior and posterior. That's why upper limb is the easiest. It has divided into anterior and posterior. So what are these? These are the septa, right? Septa. So these are the septa, anterior portion, posterior portion. Anterior portion will be doing the flexion, right? And posterior, obviously, uska ulta, that is the extension. Done. That's it. Today we'll be completing this. Next time we'll be completing this. Arm over. But is it so that when we'll be discussing anterior, we'll be restricting only to anterior? No. Some of the things, because in arm, some of the things from posterior compartment will be coming to anterior. Some of the things which are into anterior, they'll be going to posterior. That is what is happening. And this is something which is favorite thing for all these Viva takers, right? They ask you such questions. So I will keep on leaking the paper. Viva part. This, no need to discuss. The acromion process, this is greater tubercle, lesser tubercle, in between is the intertubercular sulcus, right? And this is the medial epicondyle, right? This is the medial epicondyle. This one would be the lateral epicondyle. But thing in which we are very much interested is the deltoid tuberosity, because on that day we discussed that deltoid, which is a big muscle, and it comes all the way over here, right? And it is so powerfully attached that it creates that landmark, and that is the deltoid tuberosity, right? This is the deltoid tuberosity. So very prominent. It is on the lateral side, obviously, right? Because it is created by deltoid. But this level is of very much interest, and this level, that what are the things which are occurring at the level of deltoid tuberosity? That would be a major question, right? And we'll be discussing every point in detail with the images so that there is absolute clarity. Okay, last, 2 TB enough for the whole MBBS? Absolutely, yes, Arshil. After that, I'll not be taking. I will be after completion full upper limb. Yes, test will be taken after the completion of the entire upper limb. So you can say just before 2 weeks, less than 2 weeks. When will be the test? Well, that's what I said. The day will be completing this palm. And one more extra session, that would be the clinical, because that session is not on YouTube. And I really want you to understand CT, MRI, and angio, right? Along with obviously the plain X-rays, where I want you to show the fracture of neck, fracture of shaft, fracture of epicondyle, Colles fracture, right? That is the fracture which is of scaphoid when the fall is on outstretched hand. So how it really looks like. What happens when those fractures, they heal, right? When person, it is reduced. Now, whether that reduction is only with the maneuver, or if the bone is badly broken, so one might have to put the needles and the plates. And then what happens after the healing? What if that healing is not proper or it is incorrect? What would really happen, right? So all those things we'll be discussing. So there'll be one session which will be purely on clinical things, absolutely on clinical things, right? But yes, it is expected that on that day we won't be discussing any of the other topics, right? Straight away we'll be focusing on that. Okay. So this deltoid tuberosity level is of very much importance. Here it is, things known to you. This is surgical neck. Yes, that's the surgical neck. So surgical neck associated with sorry, axillary nerve. Yes, that axillary nerve which is winding posteriorly, going posteriorly, and it is associated with this paka. Paka is posterior circumflex humeral artery. right? And it winds around. आगे से it is anterior circumflex humeral artery, and then they make the anastomosis. Done. So that is fine. Axillary nerve is the branch of which cord, right? So we said, remember it like part posterior
Post
cord. So it is this axillary, and another one, its sister is
radial.
radial,
Radial.
right? नाम ही देखो posterior. So radial will be going posterior, right? Radial will be going posterior into that groove, right? Along with
Radial.
artery, right? We'll see that. So here it is. This is the surgical neck, and this is the axillary nerve, which is associated with that. And here is the delta tuberosity, which we are talking about, that it is a wonderful landmark. All right, done. We go down. As we go down, right? So this is the capitulum and trochlea, this lower portion. Soon as we approach to that point, right? But this is, yes, Sayukta, just ask, unmute yourself, ask straight away. Okay. So this trochlea is like a pulley, right? When we'll be discussing the elbow joint in more detail, we'll be talking about more for it. But right now, capitulum is something like a round structure, and trochlea is like a pulley, right? It is like a pulley. हाँ बोलो.
सर कैपिटुलम ये बोन है या फिर ये टिश्यू है?
सॉरी दोस्त, आपकी आवाज कट गई. कैन यू रिपीट?
कैपिटुलम बोन है या फिर टिश्यू है?
हाँ. Capitulum, trochlea, they all are the parts of अपना humerus, right? These are the lower part जो है ना humerus के. जैसे यहाँ पे we said these are epicondyles. ठीक है, यहाँ देखा ना. Say here we said this is the epicondyle, this is the lateral epicondyle, right? और यहाँ पे do you find this is round thing, and this is something like pulley, right? So this portion is called as the capitulum, and this pulley like thing, right? Pulley कैसी होती है? This is like pulley, है ना? And then we put a rope and it right, and that balti goes into the well, and then pani खींचते हैं. Hypothetical हो गया, but this is the pulley, and that thing is called as the trochlea.
Sir, the ulnar bone articulates with the trochlea.
So wait, अपना when elbow आएगा, at that time we'll be discussing at length. और अभी के तो just थोड़ा समझने के लिए. हाँ. So surgical neck, you know about it. Surgical neck associated with that axillary nerve, पता है. This is the posterior cord. Posterior cord is giving power, right? Axillary and radial, so that is done. What we are watching is now the posterior part. On posterior part, there is one groove, and this is the royal groove, royal radial nerve groove. So this is the groove through which it would be passing, right? So see, axillary and the radial, apna par already known. That's the radial groove.
तो
हाँ.
आपने बताया सर्जिकल नेक, वो बेसिकली वो पार्ट नेक बनाया जहां से हम सर्जरी करते हैं अगर फ्रैक्चर रहा तो. लेकिन
हाँ,
अगर जॉइंट ही क्रश हो गया है तो क्या कर सकते हैं? मतलब उधर क्रैक आ गया.
all those things are like very logical. Now, if the joint is crushed, you tell me what will you do? Nothing can be done, because if it is normally for these things, say you won't find a crushing of the joint. कैसे होगा crush, right? Because in order to crush, मतलब पूरा मशीन के अंदर उसको बिठा के, right, and then आगे और पीछे से एकदम properly crush करो, तब जाके वैसे इंजरी होगी. And for that we'll need lots of cooperation from the patient. कि boss, we are going to crush, right? Accidents when they occur, they occur because of the impact. When the impact is there, so the area which is weak, that gets broken. Done, right? But मतलब अगर जो किसी का पूरा से लेफ्ट हैंड क्रश हुआ है, राइट, एंड तो वो कहीं कभी मशीन के अंदर चला गया था, राइट, मशीन के अंदर चला गया, एंड द फिंगर्स एंड एवरीथिंग वाज क्रश्ड. कोई बोले कि बहुत बहुत अच्छा हुआ लेफ्ट हैंड क्रश हुआ, राइट, राइट हैंड होता तो आप काम कैसे करते थे? तो कहते हैं कि मैं ऐसा बेवकूफ थोड़ा ना हूं, आया तो राइट हैंड था, मैंने निकाल के लेफ्ट हैंड दे दिया, राइट. सो दैट कैन लीड टू ऑल दोस क्रशिंग जॉइंट्स. But usually,
Sir,
yes, go ahead.
so why is this called royal radial nerve and not just radial nerve?
अरे रॉयल तो यार हमने नाम दिया है, ऐसा कहीं वो बीडी स्टोर से मैं ढूंढने मत जाना कि चलो नहीं मिला तो लेट्स गो टू ग्रेज एनाटॉमी एंड व्हाई इट इज रॉयल रेडियल. विल कीप ऑन गिविंग. अभी तो वीआईपीज आएंगे, मिनिस्टर्स आएंगे, बहुत सारे नाम आएंगे, राइट? सो वी कीप ऑन गिविंग सच नेम्स.
Okay.
एंड व्हेन यू लर्न, इफ यू लर्न पैथोलॉजी फ्रॉम मी ना, तो बस खाने पीने की आइटम्स है, मतलब चीज है, पनीर आएगा, राइट, काजू कतरी, ऑल दोज थिंग्स विल कम. तो याद रहता है. When it is associated with food, तो then you feel like हाँ ये बिल्कुल डोनट जैसा लग रहा है. अच्छा किया पूछा, नहीं तो वाइवा में जाके बोला था वो रॉयल रेडियल ना हो. इट्स ओके, इट्स ओके, राइट. रॉयल मीन्स, सी, विजुअली दिस इज हाउ आई यूज टू फील कि यार पूरा रास्ता बनाया हुआ है अपने लिए. मतलब when you run Tata Mumbai Marathon, तो वहाँ when मरीन लाइंस पे आप दौड़ रहे हैं अकेले, एंड यू फील कि नॉट अ सिंगल कार, यहाँ पे 400 कार इधर खड़ी है एंड यू आर रनिंग, तो दैट गिव्स अ रॉयल फीलिंग. तो आई यूज टू थिंक यार ये रेडियल नर्व को भी ऐसा ही लगता होगा ना. कोई नहीं, मेरे लिए पूरी टनल बनाई है ना, आई एम पासिंग थ्रू इट. सो दैट्स व्हाई आई गिव द नेम रॉयल रेडियल नर्व. एक्सक्यूज मी फॉर लेस देन 1 minute. Okay, back. Chalo, one good thing. I received the CD of one of the real patient of that coronary angiography. So next time I'll show you that. So that would be like a video, right from the catheter to the injection of the dye, and then as it spreads across. And in this case, so this is left circumflex, this is left LAD, left interdescending, and this is the right coronary artery. So here there is 80% block, and here also this is about 60%, and then there are 2 blocks over here. But because now this is like a complete video, right? This CD won't be running into normal CD players. You require a software called DICOM, right? DICOM. So via DICOM only you can really run it. So I'll show you all those things. Just receive the CD by Blue Dart. So we'll be able to see. Okay, coming back to this is the royal radial nerve, which will be passing through this radial groove. Moving further. This is a section, this is the image which has been taken from our BDC. So here it is the humerus, here it is the humerus, right? And it is dividing into entire arm into, this is the cross section of the arm into anterior and the posterior. Anterior is called as the flexor compartment and the posterior is called as the extensor compartment. Now this is the septum, right? Septum, what it is really doing, this particular septum over here and over here. So it is the intermuscular septum because it is between the flexor muscles and the extensor muscles. So Okay. Now regarding those surgical neck, etc., we'll discuss later. Else we'll keep on remaining over there only. So last में सब discuss कर लेंगे all those points. So this is the intermuscular septum, right? One, what is on the medial side, so we'll be calling medial intermuscular septum, and one which is on the lateral side, it is called as the lateral intermuscular septum. So basically, it is dividing into anterior and posterior. On anterior side, on the flexor compartment, we have got again two septas, right? One septum, which is transverse septum because of its situation, and another one, it is enteroposterior, right? That's the enteroposterior. So actually speaking, the flexor component, once again, it is divided, right? It is divided 1, 2, 3, and the extensor is one single shot. So these are like what is called as the intermuscular septum arrangements, which we can see it over here. Things which might have come to your notice that on the top, this is the shape of the humerus, which is round. But as it goes down over here, you can say that this is triangular, right? This is triangular. This change of shape is very important. And at what level this shape defines, the level will be our ball
Deltoid
point.
tuberosity.
That's right, deltoid tuberosity, right? So deltoid tuberosity, we have already started giving importance to the deltoid tuberosity. That one change, which is the change of the shape. So this is one. Let's proceed further.
Sir, why this step is changed?
Why this
Step change.
shape change? Shape change is because of the arrangement of these septa. Over on the top, right? The muscles, they are not yet grouped. They are collective, right? They are more related to the shoulder. As they go down, I mean, you go to gym,
Yes, sir.
right? Now, if you go to gym and if there is a beautiful girl, so what would you try to show off? अरे बोलना यार.
Biceps, triceps.
बाइसेप्स ना, वो ट्राइसेप्स तो वो था
Yes.
वो ऐसे करके देखेंगे, वो बाइसेप्स ही दिखाएंगे ना. बट टुडे यू विल फाइंड that biceps is just for showbaji, right? The real power comes from another muscle, right? And that's the point. That's the thing. That is, as it comes to the lower portion, when the things are clearly defined, the brachialis muscle comes to that point. So, aate hain, we come to that point. But this is clear that this is more or less related to the shoulder muscles. And while as we come down, it is related to real functionality of the flexor components, right? Okay.
But sir,
Yeah.
when the lower body strength is good, then the person looks big, but so it's good now.
Let's see. Acha. So this one already you know, right? CD is coracobrachialis because it is starting from coracoid process and all the way it is going to the arm, right? So this is the coracobrachialis. Then onto this, we have got the short head of biceps, which is also connected to coracoid process, right? So coracoid process, it is giving birth to two. One is the short head of biceps and second is the coracobrachialis. Which one is superficial? Short head of biceps is superficial. Showbaji, na, dikhana hai, that's why that muscle will be up. Why we say it's showbaji? Because this muscle is not used for flexion. So boss, jitne dumbbells leke he hu karte rehte hain, right? So they are not making your biceps. So if you want to make your biceps, you know the biceps, when your girlfriend tells कि बॉस ये बॉटल खोल देना एंड देन करके खोल दिया, नहीं खुल रही, राइट? तो तेरा बाइसेप्स यूजलेस है. Biceps is classically used for the corkscrew motion, right? So it is a tight bottle. याद इस तरह से रखो. It is a corkscrew muscle. So if you want to open a tight bottle, so that is where the biceps is used. But for the raw flexion, it is the brachialis which is used. So gym में if everyone मतलब जो standard डंबल से काम करते हैं, right? Let them do. उनके biceps कभी इतने powerful नहीं बनेंगे. Unless and when you start doing this, right, just rotation, right, your biceps would be far better, far better. Right? That's the advantage of studying in medical. किसी ने पूछा था मेडिकल में पढ़ने का फायदा क्या? ये फायदा बहुत सारे. This is one of them. So here it is that we have got the biceps, two heads. One is short head, one is long head. This long head of biceps, which will be passing through this bicipital groove, right? So here it is. Now we start adding multiple components, one after the another, right? From this point onwards, we are rebuilding the entire structure. एक करके structures will keep on adding. So this is coracobrachialis known to us. On that, we add one nerve. Immediately we remember, we see that this is the nerve which is emerging, right? यहाँ से निकली, and it pierced this coracobrachialis. Never ever forget this, because this could be one of the Viva question. Because this is the only nerve which pierces the muscle like this, right? And this nerve is the musculocutaneous nerve. Musculocutaneous. This means it will be supplying muscles also, and it will be supplying some cutaneous. Cutaneous means skin, right? So this is a mixed nerve. It is sensory as well as motor, right? So when we say it is sensory, when it is sensory, sorry, when it is sensory, so it will be supplying to some skin area, right? And when we say it is motor, so it will be supplying to some muscles. Very true. The muscles which are present into this region, which muscles are they? So it will say कि यहाँ पे तो coracobrachialis को pierce किया, तो obviously it will be supplying to coracobrachialis. Coracobrachialis के ऊपर we have got the biceps.
Bicep.
Right? So that is also supplied. And नीचे कब से जिसका
Brachialis.
brachialis, so that is also supplied. Done. Yeah, we have finished the musculocutaneous. We have finished because it supplies. So how will you describe it in style? That coracobrachialis is a nerve which emerges from which cord?
Lateral.
Lateral cord.
Lateral cord.
Why not medial cord? Because two ends never meet. Correct?
Yes.
Two ends never meet. So medial cord का क्या होता है? What happens? Wait. No, Vedant. Unmute. फटाफट यार. Vedant.
Yes, sir.
शाबाश. चल. बोल. What happens to the medial cord? Medial cord. There is, I'm giving you a hint. There is one median nerve. Median nerve कैसे बनती है?
ऐसा नहीं समझा सर.
नहीं समझे? What I'm asking is medial cord तो पता है, brachial plexus पढ़ा नहीं पढ़ा? Yes, no?
Yes, पढ़ा है.
पढ़ा है, शाबाश. Medial मतलब brachial plexus में 3 कॉर्ड बनती है, right? राम तो दूर चला. Root, trunk, division, and cord. We have posterior cord, we have medial cord, we have lateral cord, right? What I'm asking is ये medial cord जो है, medial cord का क्या होता है? What happens? Medial cord बन गई, then अब आगे क्या? How is the medial cord made? बनती कैसे है? Who makes it? Cord यहाँ पे है, so it is made with some divisions. किसका division? और किसके division? नहीं. नहीं, जो मे आई वाले जितने मुझे पता है, बिकॉज यू नो द आंसर्स. मेरे साथ भी ऐसे होता था, किसी को क्वेश्चन पूछो वो मुझे आता था. वेदांत, डोंट वरी यार, बोल. स्पीक ऑफ, जितना आता है बोलो. राइट, विल स्पेंड रियली 2 minutes. स्पीक ऑफ. वंश साठे, अनम्यूट. शाबाश. हाँ चल बोल. हाँ बोलो.
Sir, it is formed by the. Sir, I'm Ishan, by the way. Hello.
हाँ बोलो.
Sir, median nerve is formed by the lateral root and medial root.
Median nerve is formed by the
lateral root and medial root.
Lateral and medial root, right? Lateral root come from lateral cord, medial root will come
Yes.
from medial cord.
Yes.
Okay. ठीक है, this much is sufficient. अभी आगे और question बाद में पूछेंगे, right? So we have got now this musculocutaneous. So इसकी बात हो गई, right? So here it is. Now we are putting it. This is BB. BB is going not that BB, right? This is biceps.
Break.
Biceps brachii. Right.
Biceps break.
Brachii. So biceps brachii, right? So we have got two heads. One is the long head, one is the short head, because long head is passing all the through this royal tunnel, right? Radial groove, right? So that bicipital groove, bicipital groove, and then it is passing all the way and it is going to that supraglenoid tubercle, right? So that's why it is long, and this short is going to this coracoid process. Done. Because it is say likha bhi tha maine. Show off, it is for show off, but really it is the muscle which is called as the corkscrew muscle. Corkscrew muscle means opening a tight jar. क्या लेते हो? थोड़ा बढ़ाओ.
सर में आए.
नहीं, रुको. यहाँ पे 2, तो यहाँ पे बाइसेप्स, तो यहाँ पे
Triceps.
और क्या? It is triceps. So here it is the short head of biceps. We just saw that it is going on coraco process, right? This is the bicipital aponeurosis. It means that those biceps, right, short head, long head mix, eye niche, and now they are going on to getting attached at a small place, right? But before that, this is like a flattened sheet, flat sheet. So these are the contractile fibers, and these are the non-contractile fibers, which is in the form of aponeurosis. It should be acting like a very powerful sling, and they will land. And itna powerful muscle, right? Itni bottles khole. So obviously it will create some good impression, right? It will create some good impression, and that thing is called as radial tuberosity. Right? So when we'll see this bone, when we'll see this radial bone, we will invariably say कि नहीं दोस्त मस्त यहाँ पे this is the radial tuberosity, and it is the place where the bicipital aponeurosis will be landing. Okay? So this is clear. By the way, this area is also called as the cubital fossa. Cubital fossa. Right? Cubital fossa. So cubital fossa is this.
Elbow.
Right? Elbow. When it will come to knee, so it is called as the popliteal fossa. Right? But jab lower limb aayega tab ki baat tha. So here it is, the flat tendon bicipital aponeurosis. Now over here we see something very crisp, and this is the brachial artery. The brachial artery which is coming from the top, and it is at this point it is dividing into radial and the ulnar artery. Right? It is dividing, and then the radial will be going on radial side and ulnar will be going on ulnar side. And in style, when we take the pulse, so that pulse is always of a radial artery. क्यों ulnar artery में से नहीं ले सकते? Because ulnar artery, as we'll proceed further, when we'll be studying the rest.
It is posterior.
Yes.
Ulnar.
That is one. And second thing is, radial is sitting on the radial bone.
Bone.
So there is a
Oh, this
solid
bone,
surface
solid
which
bone.
is underneath. Yes. So we'll be able to feel the pulse properly. जबकि नीचे अगर जो base weak है तो if we try to take the pulse, so that artery will be it will dip inside. We won't be getting that reverse thrust so properly. So right, that's why the radial. By the way, brachial artery is also very important when we take the blood pressure. Right, when we take the blood pressure. So if in your armpit, right, if you really touch, so you'll be able to get the pulse of brachial artery because it is pretty superficial. And when the sphygmomanometer, when you take the blood pressure, so first you increase the level, you increase the level. There are two types of blood pressure. One, what is called as the systolic, and second, what is called as the diastolic, right? The understanding is very simple. Diastolic is that minimal pressure. Pressure is what? Pressure is that force which is exerted on the walls, right? The force which is exerted on the walls. So when the heart beats, contracts, that is called as systole. So at that time, large amount of blood is pushed and it will be putting pressure on the walls. So we call that thing as a systolic. That's why systolic is higher. When the heart relaxes, ऐसा थोड़ा है कि blood भाग गया. There is no blood into the artery. No, there will be some blood into the arteries. So at least they will be keeping that pressure. That is the diastolic pressure. So that's the reason that whenever you treat or when you check any of the patient, if his diastolic pressure is high, so then it is a matter of concern. What I mean to say is we have got two patients, one patient whose blood pressure is 150 over 82. Normal is 120 by 80, correct? 80 millimeter of mercury, Hg, right? Mercury. This is millimeter. One patient is this, another patient is whose blood pressure is 140 by 92. This is more dangerous because at any given point of time, the 92 millimeter of mercury pressure, it is constantly onto these walls. It is not only these walls, but this is the pressure which will be borne by all the organs. Now, those delicate, soft organs, obviously, they'll start breaking under that high pressure. Right? So that's why always the diastolic is more important as compared to the systolic. Systole is very much affected by what you eat, drink, right? You take coffee, it rises and then it drops. You start running, more blood is needed. Yes, thak, right? But blood will be pushed, systole will rise. But the moment you take rest, immediately it will come down. But this diastole is that real parameter, right? Do remember.
Sir, these are the case of hypertension, no?
Hypertension, yeah, increased blood pressure. That's right.
Yes.
Right? And when we in physiology, we'll study more in detail that what is the role of sodium and what is the role of potassium. Why apna Tata namak, sada apna Tata namak, which is sodium chloride, that is so dangerous as compared to that Himalayan salt or pink salt, which is the potassium chloride. Right? Very effective, especially those who are doing gym.
Sir, hypertension.
Hypertension means increased blood pressure.
No,
High
sir.
blood pressure.
I was asking, is it also caused due to stress?
Yes, it definitely can increase due to stress because in stress, it is that sympathetic nervous system which is triggered, right? Sympathetic nervous system. We have got in autonomic nervous system, sympathetic and parasympathetic. Sympathetic is for fight and fright. लड़ना हो या डरना हो. That's why मतलब पहले तो बहादुरी दिखाते हैं, अरे झगड़ा करना है किसी से, राइट? पर पता चला कि यार वो सामने वाला तगड़ा है, तो देन व्हाट वी सी, भागो यहाँ से, राइट? सो वेदर इट इज फाइट और फ्राइट, in both the cases you'll require good amount of blood into your lower limbs, right? So at that time you'll not say कि यार मैं पहले सैंडविच खा लूं, अच्छे से डाइजेस्ट हो जाए फिर भागना शुरू करता है, अरे हार्ट विल से मर जाएगा साले, right? So heart will start beating fast, brain will say all muscles ready, भागो, right? And that's what they will do. इसलिए आंखें बड़ी बड़ी हो गई, right? So that's why this is like there would be dilatation of pupils so that more light comes, पता चले कि कौन सा रास्ता है भागने का, right? And that's how it really works. Digestive system and all those emotions, वो सब गए तेल लेने, वो बात की बात, right? अभी कुछ नहीं, right? And when it comes to parasympathetic, right? When it comes to parasympathetic, मस्त, right? Pizza, visa, this, that, everything खा पी के बैठे हैं, Netflix चालू करके बैठे हैं. तो its function is rest and digest, right? Rest and digest. And then you feel like यार ये पंखा बंद करना है, कौन उठे यार? So that sort of thing. So that is the rest and digest. That's the difference between both the things. But yes, when the heart is beating fast, and when the heart is beating powerfully, so it is the left ventricle will say, okay, I'll take that, right? Push the blood into the aorta. When the blood is pushed into the aorta, so obviously it will generate more pressure, right? So stress. Taklif kya hai? This is our default system. This is our default system. Normally, this should be the system. ये ना मतलब सीरियसली गाली बोल के आज के जमाने में, अरे कम ऑन, देखा पड़ोसी का बच्चा इतने मार्क्स लाए और तू साले इतना मार्क्स नहीं आए, ये वो कंपैरिजन एंड एवरीथिंग. बेचारे ये लेवल सेट कर दिया है. आई वॉज टॉकिंग टू वन ऑफ माई फ्रेंड, ये जनरेशन जी वी कुछ नहीं, क्या मतलब, दिस इज अ बिग स्कैम, बिग स्कैम. मतलब देश है क्या जनरेशन अल्फा, एंड देन अभी तो नई जनरेशन की जो अभी 2025 में जन्मे, जनरेशन बीटा. तो क्या सबके डीएनए बदल जाते हैं? मतलब इट इज नॉट द कंप्यूटर्स यार. कंप्यूटर थोड़ा ना है कि भाई नया प्रोसेसर लगाया, चलो नाउ दिस इज लाइक यू आर ऑन टू दिस न्यू वर्जन. नो, बट बिकॉज ऑफ ऑल दीज मेंटालिटी, राइट, दे हैव स्टार्टेड क्रिएटिंग द गैप बिटवीन द जनरेशंस. They have started creating the gap, and that's the trouble. That's the trouble. If you really go to deep web, some amazing discussions are there. It is not always bad, but it is like a very systematic, proper scam which is going on, so that they say that isolate the generations so that they don't take the advantage of the previous generation's experience, right? Otherwise kya hota hai? So this is the most effective way of isolating a generation so that they can easily be kept as a slave. Yeah, I use the word slave. पता है किस चीज के slaves? Digital slave. Digital slave. कैसी games आ रही है? Anyway, we'll talk about this later, but just thought of sharing this thing with you. So, by default ये चीज हो गई. Sympathetic जो है वो activate हो गई. So दिन रात बस मुझे आगे बढ़ना है, ये करना है, वो करना है. Now this thing will lead to increased blood pressure. So obviously patient बनाने शुरू हो गए ना. Pharmaceutical companies will say क्या ये मरने ही वाला है, ये आएगा अपने पास अपनी दवाई लेने. Now this stress will lead to insulin resistance. So increase this diabetes mellitus, increase hypertension, right? And because of this, the hormones की सफाई हो गई. Hormones खराब. When the hormones are affected, right, and then all these ulti cheeजें शुरू होनी शुरू होती. So this is something which is, and when this thing happens, who cares about doing exercise or taking care of themselves? Pharmaceutical companies involved, food industries involved. नहीं खाना बनाने में टाइम लगेगा, एक काम कर, बर्गर ऑर्डर कर, राइट, जल्दी खा के पढ़ने बैठते हैं, बस उनका पर्पस हो गया क्लियर. And if someone senior tells कि बॉस मत खा, नहीं, आपको नहीं समझ आती, right? Because they have created that partition that you are from previous generation. वो तो जिस दिन बीमार पड़े, जिस दिन वो एंजियोग्राफी हुई और पता चला कि ब्लॉक आया, तब कहते कि यार बात सही थी, पर तब तक बहुत देर हो चुकी है. Youngsters, they are getting heart attack. Why? Because of this constant tension. अरे चीज मजे मजे से पढ़ो, राइट. I'm telling you, I'm guaranteeing you, मतलब मेडिकल साइंस इज सच कि इवन फाइनल एमबीबीएस में भी you'll find कि यार कितनी सारी स्टोरीज सुनी अच्छी अच्छी, and then you will be able to recollect. When the patient comes in front of you, we say his history is important. I always say no, his story is important. What he or she is telling, his story is important, and then the entire perspective changes.
Sir, I have also heard that many young people are dying of heart attack in a very young age.
हाँ,
So, what could be the main reason and how should we cure that? Or not take
मतलब
care of.
ये उसके लिए because we'll be going off the topic, that's why मैंने ये थोड़ा डिस्कस करके अभी रोक दिया, but we'll keep one session on that, right? Because stress is a major killer. I'm not telling कि आप पढ़ाई छोड़ दो, right? टेंशन ही नहीं लेना, right? वाइवा में क्वेश्चन आएगा तो आएगा, नहीं तो कोई बात नहीं, नहीं, नहीं. पढ़ाई अलग चीज है, focus is a different thing, understanding is a different thing, and handling stress is a totally different ball game, completely different, right? मजे मजे से आराम आराम से पढ़ो, बिकॉज कंपटीशन सिर्फ एक जने के साथ ही है. व्हेन यू स्टैंड इन फ्रंट ऑफ मिरर, तो उसमें जो दिखे उसके साथ, दैट मीन्स कंपटीशन इज विद यू ओनली. यू इंप्रूव, डोंट कंपेयर योरसेल्फ विद एनीवन एल्स. हाँ, so here is another muscle. This is the brachialis. Now he is the real hero. This is the muscle of the arm and is the major flexor. Major flexor. Right? So this is a major flexor. Lower half of the humerus, right? This will be coming into the lower half of the humerus, and it is this area when that bone is triangular in shape. When bone is triangular in shape, so we have got, this is the anterior border, right? It would be the anterior border, and this is the posterior surface, posterior surface. So when it is triangular, one side, it is the medial, other side, it is the lateral. So that's why anteromedial and the anterolateral are the borders. Meantime, we have removed all other muscles, so at least over here the humerus is seen. And when we are watching the humerus, so we start watching the muscles which are on the back side also. Right? So here it is the coracobrachialis, that's fine. But these three, 1, 2, and 3. So this one, this is that muscle which is seen, which is as such posteriorly. So this is the triceps. So we are having over here the long head. This one is the lateral head, and the muscle which is just underneath,
Medial.
right? And this is medial head. So 3 heads. So that's why the triceps. Triceps. So back to our musculocutaneous nerve. Musculocutaneous nerve which pierced that coracobrachialis, right? And then that came down all the way. Now, when that nerve comes down, so it is supplying this biceps brachii, brachialis, and coracobrachialis, so it pierced. So the muscle which it will be supplying, so they are called as the muscular branch, obviously, the muscular branch, right? Kaun si badi baat. So there'll be the muscular branch for biceps brachii, muscular branch for brachialis. So that's how the muscle, right? It is the cutaneous also. Okay. So we talked about musculocutaneous. Now here comes, as we see, that there are 2 other nerves on the medial side. So this is the medial side. This is the body. So this would be the medial side, right? This side would be the lateral side. On the medial side, we are watching the arm, right? This is arm. On the medial side, we watch that there are 2 nerves which are coming. One, which is a reasonably big nerve and going all the way on the medial side, and that is none other than median nerve. Median nerve. So now you see, this is the median nerve. And then above, this is another nerve which is giving darshan, right? And that is the ulnar nerve, right? This ulnar nerve we can watch, right? But this ulnar nerve is very typical. कभी हाथ टकराया है ऐसे and then पूरा हाथ
Yes.
right?
Yes, sir.
People call
Every
it
time.
हाँ every time. अब तू तो यार सबसे ज्यादा मारेगा इस एनाटोमिस्ट को. They say this is a funny bone or funny nerve. अरे funny लगे तो पता चले कि कैसा दर्द होता है and हाथ का क्या हाल होता है. Correct? But they say it funny, right? ठीक है, चलो भगवान भला करें उनका. But this is the nerve. The point is that this nerve passes through that groove. this nerve passes through that groove. And abhi bhi, yahan pe, if you feel, if you just press, so you'll come to know that yes, it is painful. But it becomes damn cord-like structure, as if moti rassi hai, in case of leprosy. Leprosy. Right? Leprosy is one disease. So in that, this nerve becomes cord-like, such thick nerve. So you just touch there and you feel and you find that yes, it is cord-like nerve. You will never forget.
It becomes
That is it.
prominent, sir.
Yes, become very prominent. So this is the median nerve. Median nerve, as someone already explained, that it is made with a combination of medial root and the lateral root coming from respective cords, medial cord and the lateral cord, and that's how the median nerve is formed. So now we have done the good darshan of musculocutaneous nerve, ulnar nerve, and the median nerve. Like, let's move further. This is behind me, it is popliteal. Achha. Now we did some natak. That brachialis muscle, right? This was the brachialis. This brachialis muscle, we made this muscle Mr. India, right? So now this muscle is transparent. So that muscle, with that, we can watch that what is happening to underneath it, right? Because otherwise, the brachialis aa gaya, to we were unable to see it. So here it is. Same thing, seen with clarity, musculocutaneous. That's the ulnar. This is the median. Very nice. And they all reach to over here. And that is what?
Cubital fossa.
Cubital fossa. Right? But over here, there is one more nerve. And this newcomer is our radial nerve. See, can we see? Here. And then it is going. Right? See marked. I'll just zoom it. Here it is. Correct? This one, this one, this one. Where was this radial nerve?
Radial
Kahan pe
groove.
baithi thi?
Radial.
That royal radial, right? Royal radial groove. So royal radial groove to was posterior. Yahan kaise aa
Posterior,
gaya?
anterior. Trans.
Yes, from posterior to anterior. But posterior to anterior aana ho to it has to pierce
Septum.
something. What?
Lateral intermuscular. Lateral
Septum.
intermuscular. Septum.
Shabash, that's the thing. Bas Viva mein yahi cheez bolna is exactly in the same style. That as the radial nerve from the radial groove, from posterior to anterior it comes, it pierces the radial intermuscular septa or the lateral intermuscular septa, right? And people will say, Irshad, Irshada, acha, wah, 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 wah. But this is the thing, right? Because they say that she has got or he has got so much of clarity. Kya clarity? Matlab radial to radial side pe aayegi. And as it is coming anteriorly, so this is what it will do, right? Very simple. Meantime, over here, this median now, all the way, right, it is coming on the medial aspect. So see what has happened. At least we can generalize it like this, that this is the lateral side. This is the medial side. On the anterior aspect, we have got radial nerve. On the medial aspect, we have got the median nerve. And this is anterior. This is anterior. And the posterior is which nerve? That funny nerve.
Ulnar.
Ulnar. Ulnar nerve. So three nerves, so now we are set. Radial, median, and the ulnar. How they are arranged. It is that visual impression that is more important. One more interesting thing is that, as we said, musculocutaneous nerve will be piercing what? Will be piercing
Coracobrachialis.
brachialis. And after that, it will be sandwiched between biceps and the brachialis.
3B.
Yes, 3B. This you already know, but still, just in 1 minute, khatam kar de, right? So C5, C6, C7, C8, T1, and these are the roots. Then the trunk is formed, right? This is straight, and C8, T1. So that is trunk is formed. They divide into anterior, posterior, anterior, posterior, anterior, posterior divisions. So that is done. And then medial has got least number of alphabets. So it is made with just one division, that is with the posterior, right? This is with the medial, that is the lateral cord. It is formed by the two anterior divisions, and all the posterior divisions, they will be making the posterior cord. And then apna standard, right? Par. Par is posterior cord. It is having axillary and the radial. Done. Two ends never meet. So this medial cord will not give musculocutaneous, right? It will be giving musculocutaneous is bilateral cord. And this will be giving ulnar nerve, right? Medial cord. And this median nerve, so it is superspecial, right? Just combination of medial and lateral. Done. Right? Then we have got the suprascapular subclavius, which comes from this upper trunk. And this is the long thoracic nerve leading to winging of scapula in case if it is damaged, which is coming from C5, C6, C7. So now this is changes which are occurring at the level of deltoid. One change already done, already discussed, from circular to triangular, that is change in the shape of the humerus. Second, we have got the intermuscular septums. They are now clearly defined. तो बड़ी सीधी बात है कि till the edge is formed, right? When the edge is there, तो then they will be clearly defined. अब तक तो राउंड था ना, तो राउंड में से तो सभी जगह से थोड़े थोड़े फाइबर निकले, तो they will be bit diffused, right? So this is much very obvious that it is clearly defined. Done. Third is regarding the muscles. This is the muscle. This is the level where that बिचारा छोटा सा, right? Totally ignored. कोई पूछता भी नहीं था, right? कि कहाँ पे है, कैसे है बेटा? This is the medial head of triceps, right? Because it was already and always under the cover of that lateral head of triceps. वो उसको अंदर cover करके, right? But this is the spot, right? This is the spot कि जहाँ पे deltoid tuberosity है, बस वहीं पे this medial head of triceps, that muscle is attached. That is the level. So just same thing. And here the coracobrachialis, right? Upar se coracobrachialis. So we are talking about this particular area, right? Area of deltoid tuberosity. Here it is. So muscles, कौन से muscles they will be coming at this level? Well, deltoid. Right? अब दाल बनानी है तो दाल तो डालनी पड़ेगी. This is the deltoid tuberosity, तो deltoid का तो नाम आने वाला है, right? But obvious. Then this is the medial head of triceps. True. Brachialis, which is going down. Correct. Coracobrachialis, which is going up. This one, coracobrachialis. So done. 4 muscles khatam. Right? Now, when you close your eyes and then you try to visualize that this is the humerus, that is the deltoid tuberosity. So ye aaya deltoid. Correct? Then from here, that up which is going is coracobrachialis. Piche to that chota sa, that medial head of triceps, and then down it is that hero muscle, that is the brachialis. Done. So this is once again a very common question in Viva, that what are the muscles which are emerging at the level of deltoid tuberosity? Not at all difficult. मजा तो तब आए कि जब ये 3 बोल जाए and ये भूल जाए. जिसने ये किया था वो आपके सामने बैठा है. I said enthusiastically these 3. Sir said, okay, now the last one. And I couldn't remember the deltoid itself. किया था ऐसा. Who was it, sir? So this is the brachialis, right? Brachialis artery, and brachialis artery as it comes down. Brachialis is basically a continuation of
Coraco.
axillary artery. At what point axillary is said as brachialis?
Lower border of
Major,
teres
teres major.
There is major. Major. Right? There is major. Very good. And the blood pressure sounds, they are called as the Korsakoff sound. Right? Korsakoff sound. कई बार ब्लड लेते हैं, राइट, फॉर द लैब टेस्ट। एक बार पियर्स किया, दूसरी बार किया, आ नहीं रही वेन्स। एक बड़ी सिंपल मेथड, व्हाट दे डू इज टाइट बैंड बांधेंगे, खूब टाइट बैंड बांधेंगे, एंड देन डू दिस, तो भी वेन नहीं आ रही। कैसे आएगी? Because the amount of pressure which you have given, that is so phenomenal that it is not even allowing the filling of the arteries. So थोड़ी देर में तो उसका हाथ सुन पड़ना शुरू हो जाएगा. What you do is take the blood pressure. This is very super powerful method taught by one sister. She said that आप ऐसा करो, बहुत जल्दी वेन आ जाती है, and yes, that's true. Take the blood pressure, right? That's sphygmomanometer. Let's say this is 130 by 92. This is the blood pressure. As you drop the blood pressure at around 100, that is between the systolic and the diastolic, you lock it. So now the amount of pressure which is exerted onto the arm is less than the systolic, but more than the diastolic. Diastolic is for emptying, and the systolic is for filling, right? Now what you have done is that now it has crossed, diastolic has been crossed, right? So that pressure is sufficient that it will not allow the emptying, but blood can enter, right? So now the thing is, when the blood is entering and it is not allowed to leave, within 10 seconds, all the vessels, they will start emerging. So this is one of the methods how you can capture any of the vein very easily. There is one more thing, those who are going to the gym, if you really want to improve the performance, but this is very dangerous, right? It is not, ये काम करना, right? It is what is called as the blood flow restriction exercises. But that how to select that blood pressure, right? Because you have to buy a tourniquet, right? So, and then your muscles, they are devoid of oxygen, right? They are given less oxygen. So it is at that point, they will start giving you the pain. And what exercise is to be done only for that 30-second window, and then immediately open it. You'll find that your performance will start improving like anything, but it is to be done only once a week, right? When during our fitness session, we'll be discussing at length about it. It is based on the same principle and the ATP, how to utilize those ATPs. Now, coming back to this is now we are watching the back, right? In the back, this is serratus posterior inferior muscle. This muscle we are talking about, serratus posterior inferior, because over here, यहाँ पे ऊपर, there was serratus posterior superior also. That's right. There was serratus posterior superior. And here is the teres major. That's the teres major. And here is our brachial artery. This brachial artery, which got its name from this point onwards, इससे पहले, it was called as the axillary artery. Now it is this junction. It is this junction. At this junction, it gives one another branch, major branch, and that is called as the profunda brachii artery. Profunda is profundus, खूब सारा, right? And that is called as also called as the AKA, also known as the deep brachial artery. Now this deep brachial artery is the girlfriend of this radial nerve. Just a minute, huh? Half a minute. So this is the profunda brachii. Profunda brachii will be going posteriorly, right? Because it will be accompanying the radial, right? It will be accompanying the radial nerve. So profunda brachii and the radial nerve, they'll be traveling into that groove, right? So this is the deep brachial artery, also called as the deep brachial artery. It will travel and it will lead to this collateral arteries, right? Collateral arteries. These are the radial, middle, and the radial collateral arteries. But remember this, right? It is going down. Meantime, this brachial artery, as it goes down, it will also give one more branch, and that is called as the superior ulnar collateral artery. There is inferior ulnar collateral artery also, right? They all are. So on the ulnar side, we have got the brachial artery, which is giving the superior and inferior ulnar collateral. On the radial side, we have got this profunda brachii, which is going along with the radial now. So easy, right? So that's how it really goes. To simplify it, here it is. This is what? This one. This is teres major. यहाँ पे it was called as axillary. यहाँ पे now it is called as brachial. यहाँ से निकली, this is profunda brachii, right? And then over here, it will be giving, this is, right? This will be accompanied by radial nerve, right? So this goes, this section, it goes posterior, right? And what about this section? This will be going anterior.
Anterior.
Direct को blood देना है, right? So over here, this is on the ulnar side. So that's why we have got the superior and inferior ulnar collateral. And over here, we'll be having radial collateral. Very, very clear. Moving further. Same thing, this is what we are watching. Now this is the anterior view. So medial side, immediately we find this medial side, right? Ulnar side. And this is superior ulnar collateral. And that's the brachial which is coming down, brachial artery. That's fine. As this brachial artery comes down, right? So here is the brachial artery. This brachial artery, as it is coming, this is accompanied by median nerve. So brachial artery, median nerve, that's one pair. This pair is already known, right? This pair is what? This pair is on the ulnar side. This is the superior ulnar collateral artery, right? It gives the branch. And it is the ulnar nerve along with it. So we studied that yes, there were nerves like there was one here, one which was going posterior. This was ulnar, this was median, correct? This was median, and this was radial. It was radial. So now the pairs have been made, right? So median now, it is going anteriorly. So that's why it is with the brachial artery, because it is this brachial artery which will be dividing into two big divisions. Simply speaking, radial and the then we proceed further. No idea. But now this is all sorts of revision. Achha, chalo. Let it come.
So it is in the end exam.
It is. Okay. So this is pair one, pair two. They are ready. They are done. And this we talked about, right? That it anterior to posterior, right? So this is the ulnar nerve, which is as such coming, and then it goes posteriorly. So these are the things, changes which we saw first, right? Shape change, yes. Then there is formation of intermuscular septum because they are now more clearly defined. Then we have got the muscles. Muscle is deltoid. Don't miss this muscle, right? Then we have got the brachialis, coracobrachialis, and then there is a triceps. But in triceps, it is the medial head. So these are the muscles which are emerging at this particular level. For the brachial artery, yes, brachial artery on which we take the blood pressure, and it goes, say, this brachial artery, which is now coming into the anterior region. It is on the medial side. Posteriorly, we have got the profunda brachii, which will be giving radial and middle collateral arteries, right? Profunda brachii, which will be going posteriorly, emerging at this level. Then we have got the brachial, which will be giving superior ulnar collateral, and this superior ulnar collateral will be with the ulnar nerve, and it will be piercing intermuscular septum till this brachial is anterior, but this branch is also anterior. But then with the ulnar, it will be going piercing the intermuscular septum until we go to the posterior side. So on the posterior side, we were having that radial nerve that will come anterior, and this ulnar nerve, which was anterior, that will go posterior, right? So that's how they changed the compartments. And last but not the least, this is the nutrient artery. Nutrient artery, it also emerges at this level. So in nutshell, we have got shape change, septums, muscles, arteries divide, right? They change levels. Radial becomes anterior, ulnar becomes posterior, right? And the nutrient artery. These are the 6 or 7 changes which are occurring at this level. From this point onwards, things are absolutely easy. Just you have to watch whatever we talked about. So here it is. Anterior view. In anterior view, पीछे से आ रही है radial nerve and the radial collateral artery. Yes, that's right, because they were coming from the back, right? So done. This is done. Then we have got, say, this superior ulnar collateral artery and the ulnar, right? They are going back. Yes, they are going back. So this is done. And the brachial artery and the median nerve, they are big boss, right? These are both of them, they are big boss. कोई branch was नहीं, main, right? Brachial artery is coming gracefully and along with the median nerve. One nerve which is present over here, this is the musculocutaneous. Musculocutaneous, which we were talking till this point of time, the muscular part, coracobrachialis pierced, and the brachialis and the biceps brachii, in between it is sandwiched.
Sandwiched.
But where is this cutaneous component? Cutaneous component, this musculocutaneous tells कि करती हूँ, काम करती हूँ. Finally, at the forearm, when the God said कि boss अब तो हाथ खत्म होने को आया, तो उसे क्या अच्छा ठीक है. So right, so it continues as the lateral cutaneous nerve of forearm. So lateral cutaneous nerve of forearm, right? So that's how it goes. So this is the cutaneous component. Moving further, right? Now it is easy. This is like identify, this is the musculocutaneous, yes. Then that's the ulnar, which is posteriorly. Median nerve along with this brachial artery, it is coming, so that is also done. Ulnar nerve, see, posteriorly, right? That funny bone, they call this thing as a funny bone. So that is over there. And the radial nerve, which is coming on the radial aspect. Repeat, same thing is there, but slightly zoomed version. This is on the back side. When it is royal radial groove, right? We just see from the side and we find that it is going into this groove. It is moving into that groove. That's why fracture of shaft, radial is affected. So here, same thing, musculocutaneous, musculocutaneous, so these are the muscles and this is what we already discussed. Lateral cutaneous nerve of forearm, it is at this point where the cutaneous part, right? That is the sensory innervation of the lateral part of the forearm starts, right? So all those sensations, they are carried and the motor part is these muscles.
Sir,
Hmm?
there is medial cutaneous nerve of
Yeah,
forearm and arm also.
There's.
Okay.
Right? So just same picture, right? And already you know about it. This pierces, it is this point, it is this point at which it pierces, and see the typical appearance, if it is there. No, I see here only. Right? See the classical musculocutaneous, and it pierces in the leading branches. Right? So this is how musculocutaneous emerges. And it is sandwiched between BB and B. Biceps brachii and brachialis. So here, just the nomenclature, right? So you know coracobrachialis, you know this lateral head, long head, medial head, brachialis, pectoralis major, deltoid, all known to you. And the nerve which is coming, it is the musculocutaneous. The nerve which is going on the medial side, median nerve. And the ulnar, which is initially anteriorly, and then at the deltoid tuberosity level, it will pierce and it will go back, right? To reach to that funny area, right? Jo haath ko jhanjhan kare. So that is where it goes posteriorly. That's the teres major, right? And no need to even say that axillary changes its name to brachialis. That's brachial artery, right? This is when it gives the branch, and this is the profunda brachii, also called as the deep brachial artery, goes posteriorly. Here is the point, right? Just zoom thing. Okay, goes. All right. So now we are over here. So this is the medial nerve, brachial artery, right? And they both are boss, they reach over here. What we are watching is the cubital fossa from the anterior aspect, right? Obviously, this is the biceps brachii tendon, right? So this is the biceps. So yes, we are talking about anterior portion. And here is, this is the radial, it will divide into two, right? It will divide into two, radial and the ulnar. But abhi ke liye, because we have to remove this muscle and we'll remove it in a short while. This is musculocutaneous, right? Musculocutaneous, which is on the lateral side. And that's why when it will come down, so it will be called as the lateral cutaneous nerve of forearm. Because as such, musculocutaneous is on the lateral side. Names, right? You know this capitulum, you know this trochlea, you know this is radius and ulna. And this is the radial tuberosity, powerful, beautiful radial tuberosity, where that bicipital aponeurosis, right, that was landing. And then there is ulnar tuberosity also. So we have got radial tuberosity, ulnar tuberosity, and capitulum and trochlea. Here it is. Brachialis. This is cubital fossa, and this is the muscle which will encounter as will be reaching to the forearm. Right? So this is a supinator. That's supinator. So it has to rotate the entire forearm. So that's why supinator. So it winds around and contracts. Now to you are all four nerves you are mastered, right? So this is the median nerve, you know, straight. Ulnar going posteriorly, right? Musculocutaneous will go on the lateral side, but anteriorly for the nerve supply, right? Sensory. And this is the radial nerve, right? Radial nerve to bas yahan pe to it is like, it will say bye-bye. So here is the radial nerve, gives muscular branches of radial nerve, which we'll be studying in the forearm. But the work of radial nerve is over. Right? Radial nerve will say bye-bye to radial artery also. We'll see कि ये radial artery गई, मैं तो यहाँ पे खत्म, तो हाँ खत्म, right? Because it will be giving muscular branches, and right in filmy अंदाज it will say कि बस अब यहाँ से जो sensations है, right? That work is for lateral cutaneous nerve of forearm, and done. And this is the median nerve.
Sir,
Huh?
radial recurrent and radial collateral were meeting. That's why it is like bye
Yes.
bye, you say.
Here is this division, right? Radial artery and the ulnar artery. So now the rapid revision. Rapid revision. So we talked about the arm, right? In arm, there is anterior and the posterior. Anterior is called as flexor, posterior called as the extensor. So we have got brachial artery, right? And the musculocutaneous nerve. So this is one. Musculocutaneous nerve root number C5, C6. It will be supplying biceps brachii, brachialis, and the coracobrachialis. Star on coracobrachialis. Right. Terms and condition applied, nahi, but this is star means it is pierced. Right. So musculocutaneous nerve, it pierces coracobrachialis. Done. For the posterior, we'll be dealing with the triceps, but in that region, we'll be having profunda brachii artery and the radial nerve, right, into that special groove, right? Let's like royal groove. So royal groove. Right? For the nerves, we need to talk about the musculocutaneous nerve. Musculocutaneous nerve from which cord? Musculocutaneous nerve from which cord?
Lateral.
Lateral cord.
Lateral cord, right? And it has got motor and sensory. Motor is biceps brachii, coracobrachialis pierced, and the brachialis. Sensory, it continues as a lateral cutaneous nerve of forearm, right? Done. On to the median nerve. Now, median nerve and the ulnar nerve, they are like VIPs. Right? Arm में तो बस घूमने फिरने के लिए आई है. They don't supply even a single muscle. No muscles of arm are supplied, right? Then when they reach to forearm, then they get the Brahmagyan that Bhagwan ने हमें जन्म दिया है तो कुछ काम करना चाहिए. So then they start supplying to them. But otherwise still VIP, they are VIP in this arm region. So median nerve with brachial artery, that is on the medial side, ulnar nerve, right? As it goes to the posterior, right? This is the medial epicondyle, which is called as the funny bone. क्यों funny bone? झटका लगे, right? And the leprosy, where it becomes like a cord, cord-like. That is the ulnar nerve done. Radial nerve, बिल्कुल posteriorly, with किसके साथ? With another big boss, profunda brachii, right? They travel into radial groove posteriorly, and then they come out anteriorly. So for that, they have to radial side. Radial side means lateral intermuscular septum. That is to be pierced, and then they come out. Now, if the shaft is broken, this I am just introducing, right? Its real mechanism we'll understand when we'll be learning the forearm, right? Because in forearm, the wrist, right? Wrist always remains like this, but then there is flexor component which will try to flex, but then extensor component se kya raha hum bhi hain, right? So they will keep it like this. If both these components they are working fine, so then wrist is in this hand, this shape. For some reason, if the extensors they don't work, anything happens to those extensors, right? So they are not working, then normal movement of the flexor will lead wrist drop. Right? So fracture of the shaft, that will lead to wrist drop, that is radial nerve palsy. Right? Regarding the artery, all the way journey starts from axillary artery to teres major. Teres major tells now the name change, brachial artery. Brachial artery goes with the median nerve, right? Gives the branches, profunda brachii. Profunda brachii will go with the radial nerve. In the posterior part, there is nutrient artery of humerus, right, which will be at the level of delta tuberosity. We have got the ulnar collateral artery, which are the branches of brachial, that is superior and inferior. And in cubital fossa, the final, right, it divides into radial and ulnar artery. One small tip, final. In the cubital fossa, right, we'll be studying it again in forearm. But because we are now into cubital fossa, anteriorly, we'll find that there is one muscle which is called as the brachioradialis. Brachioradialis, that curved muscle, right? That curved muscle, brachioradialis. The way we said that there is a supinator, so supinator ka ulta is pronator. So that pronator teres is over here. Right? This is medial side. This is lateral side. So on one side, we have got pronator teres. On other side, we have got the brachioradialis and the space which is created. And this line, both the epicondyles, if you draw a line, which is passing through lateral and medial epicondyli. So this forms this cubital fossa, this triangle, right? This triangle. So what is there into this triangle? It has got three major structures which we need to understand in that order. We are going from lateral to medial, and you have to remember TAN, T-A-N, TAN, right? T stands for tendon. Tendon kiska? Biceps, right? Because that's the biceps tendon which is coming and it is getting inserted and which is leading to that radial tuberosity. So that would be the lateral most. That's what you have to remember, because this is the tendon which is leading to that radial tuberosity. So it will be lateral. Then A is for artery. Kaun si artery? Brachial artery, right? Because that's the artery. Because now from this point onwards, it will divide, right? But abhi divide nahi hui. So that brachial artery. Brachial artery is accompanied by brachial vein. So that is vein का नहीं बोला हमने, पर वो artery और vein साथ ही गिनते. So this is the brachial vein, and then comes the median nerve, right? So this is the median nerve. Median nerve is as such medially situated. So that is the median nerve. So this is the classical arrangement of tendon, arteries, and nerves in the cubital fossa. Right? And that's it. Done for today. Right. So thank you so much. I just put this thing into our folder.
Thank you, sir.
Thank you, sir.
And see you soon. Take care.
Hello, sir.
Thank you, sir. Bye, sir.
Thanks a lot.
Hello, sir.
Huh?
Thank you, sir. Bye,
Yes,
sir.
sir, I
Bye-bye.
emailed you about that stuff, but you didn't reply.
Which stuff? पूछ लो ना, अभी पूछ लो.
That homework and some extra one thing also I mentioned.
Homework वाला?
हाँ,
So maybe it is like जो homework गया सो गया.
okay, then no problem.
हाँ, कोई बात नहीं. From next time. अब
नहीं
से
नहीं, as in I submitted.
अच्छा, you submitted it.
Yes.
अच्छा, I'll just check.
Okay. Thank you,
Sir,
sir. Bye.
Sir, I have also submitted that audio clip.
Sir, even I had submitted from another Gmail account, like the one I was sending from. It had some storage issue. I never realized.
Okay, no problem. I'll just check it. Sure. Okay, so take care. See you soon. Bye-bye.
Bye, sir.
Thank you, sir. Bye bye.
Bye.
Thank you, sir. Bye.